This is Dr. Sajid Maqbool giving you some more tips. The situation where the parents need to be ready because the child often gets sick at a time when it is not convenient to see the doctor. It might be the evening hours, maybe at night, maybe over the holidays or on the weekend, and therefore you should know beforehand, after having discussed with your doctor, what is it that you're going to do, where are you going to take your child, and who are you going to contact. So this should be known to you through your doctor. Now, a few things that can happen, that can go wrong. One, of course, is fever, and I mentioned in one of my clips that you should keep paracetamol or ibuprofen at home, and they come in syrups, they come in drops, they come in tablets, and depending on the age, they can be used under the direction of your doctor. Similarly, vomiting and diarrhea is very common. Now, we don't prescribe too many medicines for vomiting, but in some situations, the doctor might prescribe a medicine, and if you can't get hold of him and if you must use a medicine, then you should keep the Grabenate syrup at home. When it is a matter of loose stools and they're watery and frequent, the first thing you should do is get hold of some oral rehydration salt, or ORS as it is called. This comes in packets, and you can mix it in a jug of water and give this to the baby at frequent intervals. There are some children who already have allergic conditions or have what we call wheezing or whistling sound from the chest due to asthma. You should have discussed with your doctor what to do if at an odd time the child starts to wheeze or has breathing difficulty. Children also get cuts at home, and cuts need to be cleansed properly with water and soap, and with then you can apply an antibiotic ointment that you can check with your doctor the nature of that antibiotic ointment. You can also bandage it, and you should keep that bandage at home also. Sometimes if it is bleeding, you must apply pressure. Similarly, sometimes little babies get burns, primarily because of hot water, hot tea or hot coffee, and it causes a lot of pain. So besides pain relief, which is paracetamol, the first thing you should do is use cold water liberally to wash that area, and after you have done so, you would probably want to apply an antibiotic ointment, the same antibiotic ointment that you use for cuts, etc. Now also you can get toothaches, for which again the same medicine can be used, paracetamol or ibuprofen. And if you want to use home remedies, you can use oil of clove or a clove itself locally at that particular point, and it will take the pain away. Similarly, you should keep drops for earache at home, and that should have been prescribed by your doctor. But if you don't, you can take a few drops of warm olive oil, and maybe 4 or 5 drops would be very, very helpful. So if you run into a situation where the child gets sick in the odd hours, as we call them, evening hours and at night, and for some parents it seems to happen either in the evening or at night or on holidays or weekends, then at least you should be prepared with some of these medicines that you should keep at home. Now, most of these medicines can be kept at home, and they do not have to be discarded once they're open, provided you have not kept them for long periods of time, and provided you have kept them in a cool place, such as a refrigerator, not in the freezer, but in the refrigerator. So we feel that the better prepared you are, the easier it is for you and the child. Similarly, if a child gets a nosebleed, you pinch his nose for 2 minutes like this, and you don't have to throw water on him, and you can apply the same antibiotic ointment. So making sure that you know where to go and what to do will make you a better parent, and you won't worry, and your child will not suffer. I hope this has been of some help to you. I'll come back with some more clips.